Putting a CTR in the eye early can be an absolute game changer. Let me teach you this underrated technique that is mastered by only a few cataract surgeons. But you can be one of them, so let's go. Hello and welcome back to Learn About Eyes. There are only 2 moments during cataract surgery where you can safely insert a CTR. Before hydrodissection and after cortex removal. We call the first moment early and the second moment late. First, let's talk about the classic late CTR injection. This is a patient with pseudo-X. We're gently implanting the ring after filling the bag with viscoelastic. And we make sure to be under the anterior capsule when we let go of the ring. This right here is a patient with 3 clock hours of sonural defect that happened during IA. You can see the equator being pulled toward the center. Here we're using a Sinski to guide the CTR during insertion. This reduces the stress on the zonules. Tips for late insertion are: 1. Fill the bag with lots of cohesive viscoelastic. 2. Insert towards and not away from the zonular defect. This will reduce stress on the already weakened area. 3. Guide it with a Sinski. And 4. Make sure you don't let go before you're under the anterior capsule so it doesn't open up and stretch the capsular rhexis. Now let's get to the early injection. When would you use this? When you have a lens with an apparent zonular defect at the beginning of the surgery. In this example, we can see the lens equator even before starting the surgery. In these cases, usually the whole lens moves during capsular rhexis. If the lens is decentered, you need to remember to center the rhexis on the lens, not the pupil. And here's the key to early CTR injection: viscodissection. Use a cohesive viscoelastic to go under the anterior capsular edge and dissect the cortex from the capsule. In the beginning, you're going to stir up cortex like here, but with some experience, you'll master a perfect dissection. The goal is to be able to insert the CTR without trapping any cortex. Otherwise, you'll have a terrible time later on during IA. And here's another case. Note the zonular defect and how the rhexis is centered on the lens. Nice viscodissection. You want to dissect 360 degrees. And then we carefully insert the CTR. After gentle hydrodissection, we can do our phaco and IA. We implant our lens, and as you can see, while the bag itself is still not perfectly centered, you can't see the equator anymore, and the rhexis is perfectly centered on the lens. That was it for this video again. I hope you found those tips helpful. Try them out, and let me know in the comments how it went. As always, like, share and subscribe, and see you in the next one.